Senate advises Federal Ministry of Health and its agencies to work closely with the World Health Organization (WHO) towards acquiring sufficient vaccines needed to enhance effective national response to check further spread of meningitis in the country. More bills passes second reading as part of efforts of the Senate to improve governance and deepen democracy. A need to create greater access to education engages the attention of a senator of the Federal Republic. Welcome to Senate 109 Interactive this week, where we focus on the activities of the Senate of the Federal Republic. I am Segun, Ojelade. Once again, welcome to the program. Let's start the program. The Senate has advised the Federal Ministry of Health and its agencies to work closely with the World Health Organization (WHO) with a view to acquiring sufficient vaccines needed to respond to the current outbreak of meningitis in the country. The advice followed a motion by Senator Gbenga Ashafa, Lagos State, on the need to curb the spread of the disease.
Note that meningitis is a disease mostly associated with overcrowding, lack of ventilation, and usually is at its peak during the dry season between November and April. Further notes that this recent meningitis type is a new strand of meningitis called stereotype C, unlike the previous kind of meningitis called stereotype A, which has disappeared. Hence, the vaccine that provides protection for this type of meningitis is not commercially viable and needs to be acquired through a special process coordinated by the World Health Organization. Observe that there is need for the Federal Ministry of Health and its counterpart ministries at the state level to work together to prevent further outbreak of the disease. Accordingly, resolves to 1. Direct the Federal Ministry of Health and its various agencies, parastatals, to work closely with the World Health Organization in order to acquire sufficient vaccines needed to respond to the outbreak and prevent further cases. And 2. Direct Federal Ministry of Health and other relevant agencies to carry out nationwide immunization of children and adults that are susceptible to the disease.
This is a very critical motion, one in which, as always, Nigerians expected and are expecting that the Senate would always intervene on issues that borders on their welfare, and in this particular case, with the level of death, this is a very serious issue. Distinguished colleagues, I want to say that my constituents are victims of this particular outbreak, and there are cases of death reported in more than 3 local governments that are in my senatorial district. Magama local government, Rijau local government, and Agwara local government are reported to have lost some lives. Mr. President, distinguished colleagues, perhaps when we come to look at the recommendations, there is need for us to look forward, because what is happening when it comes to disease situation in Nigeria is like a knee-jerk reaction. We only take action when the outbreak comes. And after the outbreak has been contained, some of the critical things that needs to be done to thwart future occurrence are abandoned. And I think it will be a great disservice if, in looking at this issue, we do not give some directives on this.
Zamfara State is one of the most hit states in this issue of cerebrospinal meningitis. Let me first of all commend the mover of this motion, even though it is a little bit late, but it's still better than never. The number of deaths and cases reported in this motion is indeed far beyond the record we have here. And this incident is still a continuous issue in these affected states, particularly the State, the state I come from. All the 4 local governments that constitute my senatorial district, I, Kauranamoda, Zulmi, Birni, Magaji, and Shinkafi, are so affected by this phenomenon. Like the last speaker said, Mr. President, I think it is time the month of November or to April every year are known to be periods of heat, especially in the northern part of this country, and it's also known to be a period when issues of cerebrospinal meningitis are always reported. I think it is time for government to take adequate attention to prevent as much as possible future occurrences of these issues, since it is known to be around this period when there is heat in the northern part of this country.
I follow the lead sponsor to commend the federal government, most especially the Federal Ministry of Health. Similarly, I commend donor agencies and multilateral agencies for their commitments toward helping Nigeria. What I think we need to do is for us to be proactive to ensure that how do we look into the possibility of establishing quick industries that will produce vaccines and other medicines that are required for this kind of emergencies without recourse to us to wait for the World Health Organization, UNICEF and other things to come to our aid. There are detention facilities in Nigeria, sir. The Nigerian Prison Service, the Nigerian Police, and other detention facilities. If you look at the harsh conditions the inmates are living, I think we need to look into that one to take proactive steps so that those citizens of us that are languishing there, may God forbid, if there are breakouts there, the fatalities will be worse. So
we need to plan for the rainy day. We need to be proactive. And like you know, sir, as a medical doctor, Senate President, why it looks as if we are caught napping this time around is that we are used to that particular strain, that is the serotype A. But unfortunately, this time we have a serotype C, and we have just very few doses of that vaccine available, which is not enough to contain the level of the spread at this time. And don't forget that we don't only have serotype C only, we have Y, we have Z. And God forbid, who knows the one that will come up next year. So I think that, yes, it's not good that this is happening, but I think it's a warning signal that we, on this side, we've always talked about funding the health sector. We've always talked about ensuring the implementation of National Health Act, and especially Section 13 that talks about basic health fund, where 1% of the CRF should be dedicated to this health fund. Because if they have this, definitely they will be able to stock some of these vaccines so that they will be proactive. And also, we need to strengthen the epidemiological surveillance unit of the Center for Disease Control. Thank God that in the next few days, the bill is coming from the executive. The one from TOG is already with us. We want to combine the two of them so that we will strengthen Center for Disease Control so that they will have surveillance. Because if this is strengthened, they will be able to need some of these things in the board and note them and begin to do national vaccine. I know that we are going to go on national immunization from the 5th of April, starting from Zamfara. But sir, all I'm saying is that all this costs money. We need to use this opportunity. Now that we've not finally passed the 2017 budget, we need to put more money in the health sector, especially in the primary health care, to ensure that at least at any point in time, we have some quantity of stock for these vaccines. I think doing that will help this country mitigate some of this problem. But I want to state that so far, the Ministry of Health, the Center for Disease Control, and indeed the Primary Healthcare Development Agency had been on top of this, and they are working hard, and we are collaborating with them as a committee of the Senate. Thank you.
On the 1st of April, I was listening to Mr. Chikwe, who is in charge of disease control. It was so sad when he said we have only 500,000 vaccines for meningitis in the whole of this country. If it's 500,000, which means we have, if you divide it by 37, we have only 13,000 for state. That gives us that we are not serious. I remember when we were small, the moment from the hospital, they will give you what is called vaccine to protect, that's proactive, so that as you grow up, there are some certain diseases that will not affect you. But if by 21st century, we are still talking of meningitis, malaria, all these things, we all know they will happen. When Senator Mao was talking now, he was even telling us that there is another one, there is stereotype K, stereotype N. We cannot even handle stereotype A. All what we need to do, we should allow the Ministry of Health and allow them whatever percentage of the budget they are having, we should put it for some of these diseases, and so that in order to take preemptive approach when it happens, it's not the time we'll be running up and down.
And the various agency parastatals to work closely with the World Health Organization and UNICEF in order to acquire sufficient vaccine needed to respond to the outbreak and prevent further cases. Those in favor of prayer, won't say aye. Those against say nay. The ayes have it. Prayer 2, direct the Federal Ministry of Health and other relevant agencies to carry out nationwide immunization of children and adults that are susceptible to the disease. Those in favor of prayer 2 say aye. Those against say nay. The ayes have it.
Moving on now, the Senate in the course of the week passed more bills for second reading. 3 of such bills scaled the second reading on Wednesday. 2 of them, the bills for an act to repeal the Arbitration and Reconciliation Act to conform with international best practices, though separate, were sponsored by Senators Monsurat Somonu, Oyo State, and Senator Andy Uba, Anambra State.
In their separate presentations, Senator Monsurat Somonu and Senator Andy Uba proposed the use of modern technological devices in the resolution of disputes, which by extension could help in decongesting cases in the courts of law.
The amendment to the Act also seeks, among others, to ensure that an aggrieved party has recourse to challenge the award, irrespective of the country in which it was made. It recognizes that an award given with respect to an agreement that has been rendered invalid as a result of illegality or other violating factors may be rejected by the party against whom it was made. The unique thing about arbitration is that directly or indirectly, parties decide whom the umpire is. Therefore, there is a consensus that there is expertise in that field. If the expert believes an interim order will help along the way towards resolving the case, then it should be binding without being subjected to the court bureaucracy, especially because the final decision will be enforced by the courts anyway.
The provision of this bill encapsulates a finer distinction between the law for domestic and commercial arbitration, introduces the use of technology for the transmission of arbitration agreements, provides for the time within which an application to stay legal proceedings may be made, provides for the right of a party to challenge an arbitrator's competence to conduct an arbitration, enhances the power of an arbitrator to order a party to provide security for costs or power to request evidence on
is connected therewith.
The 2014 and 2015 reports of the World Health Organization and Ministry of Health on sickle cell anemia in Nigeria are frightening. The report says that Nigeria has the highest prevalence of sickle cell disorder in the world, and about 40 million Nigerians carrying the genes. Nigeria is the most sickle cell disease endemic country in the world, and with over 150,000 babies born with the serious condition every year, majority of whom die before the age of 10, with an annual infant death of 1,000. The prevention, control, and management of the disease by performing the functions outlined in Section 3 of the bill. It will also empower the ministry to accredit reputable public and private hospitals and medical clinics across the country, including the rural areas, to function as accredited participants in the prevention, control, and management of the disease in Nigeria.
I have witnessed relations and friends that have children that have this kind of disease. The question that an ordinary person will be asking is, can we really legislate on matters bordering on love and who to marry? If you put that question side by side with what we stand to gain in terms of preservation of Nigerian lives, then the answer is yes, we can legislate. I've seen friends that 3 out of their 4 children were struck with sickle cell anemia. None of those 3 children is alive now. Why? Because the pains and the suffering and the amount of money that were expended on preserving the lives of those children was just too enormous. They couldn't cope. At the end of the day, they had to go. So what do we do? As a very, very vibrant arm of government, and because we are noted, this 8th session particularly is noted to care for Nigerians, I believe that we must all support this bill.
This bill is going to be life-saving if we prioritize the need to create massive awareness. The same thing with other preventable diseases, but this in particular. Mr. President, in my family we have sickle cell.
Further widen access to education in the area.
Education is one of the very critical areas of concern in the country as a whole. And in that part of the country in particular, Yelagoja in particular, Cross River North in particular, we all do know that education has been fast falling in the past couple of years, running to 20 years now. So I have seen that area as an area of concern. So I do believe that if we can pay attention to education, especially at the basic level, at the primary and secondary level, we'll be building a strong foundation for them as they go into tertiary, so that is why I have concentrated mostly on education.
Senator Rose Oko Cross River North on her motivation in providing educational materials in schools in her senatorial district. In the intervention, 34 schools received educational materials comprising science equipment, textbooks, reference materials, and classroom desks, as well as teaching and learning aids. It also includes 6 blocks of 2 classrooms, estimated at 185 million naira. The move is said to be part of Senator Rose Oko's vision in reaching out to the people and deepening democracy.
Right now, I'm overwhelmed with the kind gesture that Honorable has given to us, and we pray that as anywhere she is, let the good Lord keep on guiding her.
Thank God for making him to remember government and college Nigeria for his alacrity of providing all these textbooks.
I would like to say thank you to Senator Roscoe for bringing this textbook to our school. It may help us.
We promise to make adequate use of this equipment. We shall never fail ourselves and the nation.
You know, we are moving more and more into the technological age. And students from these rural areas, you know, they do not have access to lab equipment, you know. And so we cannot overemphasize the importance of these materials that we've taken to this course.
The senator urged the beneficiaries to make judicious use of the materials to enhance the standard of education in the state.
Interventions like this, especially in the education sector, and other interventions are things I'll continue to do and to continue to make for as long as I represent them. I have a passion about representing my people and rendering service, you know, true service that you're expected to do. I did that for the 4 years I was in the House of Reps, and I'm going to do that again for the remaining 2 years that I have. Let me also say that in addition to intervention in the education sector, in terms of provision of infrastructure and instructional materials, I would also in the future, going forward, in the very near future, also look at scholarships, you know, because I'm inundated with requests for school fees.
That's the program for this week. Join us next week for another package. I am Segun. Ojelade. Bye-bye.